Hello and welcome to Stestson Chiropractic's home rehabilitation and treatment video series. Today we're going to be talking about posture and how we can correct that at home, and also some of the problems that you have with postural deviations. What I would like to do now is show you actual exercises that will help reverse this and reduce some of the symptomatology that you're actually having. Today our program is on exercises for rehabilitation of the cervical spine, or specifically the neck itself. There are do's and don'ts in both of these categories. Some of the things I would like to talk to you about are the do nots. In other words, do not, as most people do today, have their head forward like this, which actually stresses and strains the neck even further. Most of us have either computers or work at desks, and when this occurs, it puts additional stress and strain on the neck and upper back muscles. So try to keep your shoulders back and your head back while you are using both of those instruments itself. Also, try not to use your arms over your head. If you do, that puts additional strain in the cervical spine, this area here, and also in the upper back portion in this area. The best you can do is reach forward, but not above your head. Arms down. Also, do not sleep on your stomach. The best way to sleep for a neck problem is on your back or on your side. Let's get into some of the exercises now so that you can actually start the rehabilitation itself. What we're going to do is actually have Sarah move in different directions. All of these exercises should be done below pain. There's no such thing as no pain, no gain in these exercises. Rehabilitation should be done below the level of pain. First, we stretch before we strengthen. You do not strengthen muscles until you stretch them. Most people that have cervical spine problems already have a loss of range of motion. They cannot turn their head properly. And so this is going to help you actually reach a much higher level of range of motion and also pain-free. Sarah, what I'd like for you to do is turn your head to the left as far as you can comfortably and keep it there. You want to keep this motion, slow stretch and hold, for about 3 to 5 seconds. Then turn it back to neutral. Turn your head to the right as far as you can, and again below pain and holding it for about 3 to 5 seconds. Then straight back. Then tilt your left ear to your left shoulder. And again, keep it there for about 3 to 5 seconds. And then back to neutral, and then tilt it to the right. And again, hold it for 3 to 5 seconds below pain. You can also take, depending upon what you would like to do as far as stretching, you can turn your head at 45 degrees and tilt your head forward, again holding below pain about 3 to 5 seconds. And then the head should come up in neutral, and then look back as far as you can and hold that position for again about 3 to 5 seconds. Again, below pain. Head straight. Whatever you do on one side, always do on the other side. So you turn it 45 degrees, in this case to the left, and look down as far as you can comfortably. And then back to neutral, and then look up towards the ceiling as far as you can, and head straight. Now for further stretching, what you can do is have yourself grab the bottom of a chair, in this case this stool, and what you want to do is tilt the opposite direction. What this is going to do is hold the shoulder from rising when you do that. Tilt your right ear to your right shoulder while you're holding onto the chair, and that way you get a much better stretch. Hold about 3 to 5 seconds to the right. Raise to a neutral position. Take your right hand, in this case, hold the bottom of the chair. Tilt your ear to the left. This holds this shoulder in place. After about 3 to 5 seconds, again raise, and you're into a neutral position. In this case, what we're doing is we're holding in different directions and stretching in a normal fashion. Now, what you want to do is actually look up towards the ceiling, and you can continue these motions. You can do repetitions a couple of different times. Head straight, look down, and hold that position, and then bring your head back up into neutral again. This is a normal way to do range of motion exercises below pain Slow stretch and hold. You're getting good exercises, and over a period of time, you will actually not only reduce the pain and symptomatology, but also you'll increase your range of motion, especially in the cervical spine, and relax some of the muscles that you have here that are so tense. Hello and welcome to Stestson Chiropractic's Home Rehabilitation and Treatment video series. Today we're going to be talking about posture and how we can correct that at home, and also some of the problems that you have with postural deviations. What I would like to do now is show you actual exercises that will help reverse this and reduce some of the symptomatology that you're actually having. As pain has reduced and your range of motion increases in your cervical spine, you can actually go into the next level of rehabilitative exercises. Some of these I will show you. It's very, very important, again, that everything is held below pain. That's very, very important. Let me give you an example. Sarah, let's have you take your right hand, and what I want you to do is tilt your right ear to your right shoulder, and take your right hand and just use one finger, either the index or middle finger, and place it on your head. Take your left hand and place it on the chair. That way it's going to support the shoulder. And what I want you to do is, with one finger, pull your head over to your right. And you want to hold that for about 3 to 5 seconds. Again, everything done below pain. It's very, very important. After 3 to 5 seconds, you do not pick up your head. You take your hand, in this case, and you're going to actually use your hand to push your head back up into a neutral position. It's very, very important. After you've stretched the muscle to a further extent, you do not want to use that muscle to pull your head back up into a neutral position. Sometimes that muscle will tighten up on you. The same thing from this side. What you want to do is take your left hand, one finger, either index or middle, and use it on the side of the head. Hold on to the chair on the right in this case, and gently pull your head over to the left side in this case, and you hold it in that position for, again, about 3 to 5 seconds. Below pain again. After about 3 to 5 seconds, do not pick your head up. Take your hand and use it on the side, again, to pick your head up into a neutral position. You can do this in all different directions if you'd like. You can do it as a diagonal, in other words, in this direction, where you're holding on with the right hand, using your left again, one finger to pull down in this direction. In this case, in this direction, 45 degrees. You can also use this, in this case, to look in this direction. And again, use your one hand finger and pull in this direction, not hard. And you want to hold on to the chair and that one finger, one finger, and you're going to pull at a 45-degree angle for about 3 to 5 seconds, and then relax. Don't pick your head up. You want to push your head back up into a neutral position. You can do that in all different directions, including looking down, and use either your left or right hand. In this case, we'll use the left one finger, and gently push from this direction straight down and hold it for about 3 to 5 seconds. Then take your hand and push straight up to lift your head. Same thing in all different directions. That way you're getting an additional stretch and actually increasing your range of motion in a safe manner. Hello and welcome to Stestson Chiropractic's Home Rehabilitation and Treatment video series. Today we're going to be talking about posture and how we can correct that at home, and also some of the problems that you have with postural deviations. What I would like to do now is show you actual exercises that will help reverse this and reduce some of the symptomatology that you're actually having. Sarah is going to demonstrate some exercises to further improve balance and reduce your risk of falling. First, Sarah's going to hold on to the back of this chair, but you can use a sink or countertop, and practice by standing on one leg at a time. Gradually increase the time from about 10 seconds to, if you can, 1 minute, and eventually try balancing without holding on to anything, but stay close in case you need help. Sarah is now going to have another exercise whereby she will just stand on her toes and balance while she's holding on to something like, again, a chair or sink with both hands, and then rock back on your heels and hold each position for 10 seconds. Hello and welcome to Stestson Chiropractic's Home Rehabilitation and Treatment video series. Today we're going to be talking about posture and how we can correct that at home, and also some of the problems that you have with postural deviations. What I would like to do now is show you actual exercises that will help reverse this and reduce some of the symptomatology that you're actually having. Stand with your feet at shoulder width and lean forward. Grab a hold of the chair, lean forward, then tilt yourself to the right, and then roll around over to the left, and then forward again. Continue doing that. Hold on to something sturdy the entire time and complete a half circle, stopping at each area for about 3 seconds and continuing. You should try to do this for at least 30 to 45 seconds. Hello and welcome to Stetsson Chiropractic's Home Rehabilitation and Treatment video series. Today we're going to be talking about posture and how we can correct that at home, and also some of the problems that you have with postural deviations. What I would like to do now is show you actual exercises that will help reverse this and reduce some of the symptomatology that you're actually having. Stress reduction for office workers is very, very important, especially if you have cervical spine problems. Sarah is going to demonstrate some very, very simple exercises that you can do without even leaving the chair that you're working at while you're at work. One of the first things you can do is just raise your arms up and stretch towards the ceiling, and just breathe in and out real nice and easy. Then take your hands and place them behind your neck and just roll your shoulders a little bit, back and forth, and then hands down, and you just want to roll your shoulders up towards your neck, and then tilt to one side, nice and easy, and then tilt to the other side, and then grab a hold of the chair at the bottom of one side and just tilt away, get a little bit better stretch, and then grab a hold of the chair on the other side and lean the opposite direction. Now give yourself a big hug and twist to one side and then the other. And then just drop your hands between your legs and lean forward real nice and easy. And bring yourself back up real nice. And then look up towards the ceiling. And then down. And head straight. And take a couple of big breaths. Inhale and exhale. This is an excellent, simple office and or home exercise routine that'll actually increase your oxygenation, allow you to think a little bit more clearly, and still give you some good exercise for mobility of the cervical spine for your rehabilitation. Hello and welcome to Stestson Chiropractic's home rehabilitation and treatment video series. Today we're going to be talking about posture and how we can correct that at home, and also some of the problems that you have with postural deviations. What I would like to do now is show you actual exercises that will help reverse this and reduce some of the symptomatology that you're actually having. Stretching exercises are an important part of treatment to relieve discomfort in your neck. They help restore motion and relieve pain associated with stiffness. Gradually increase the number of times you repeat these. These are very, very important for the continuation of rehabilitation of the cervical spine. These exercises are done in a shower. The water is actually penetrating and hitting the back of Sarah's neck in this example. And what Sarah's going to do is lower her head slowly as far as she can below pain, and the water should be hitting her neck like this. Try to keep it like that for about 20-30 seconds, and then look up at the ceiling and again continue to have the water penetrate in this area, and then head straight, and then turn your head to the left as far as you can below pain, and again the water is hitting in this area. Turn your head to the right, again the same thing. For about 20-30 seconds if you can. Head straight. Now Sarah's going to roll her shoulders and stretch them as far as she can up into her neck, and then release. Again, the water is hitting her in the back. Push up again. Again, everything is below pain. And up again and hold that position. And then relax. And now Sarah is going to push her shoulders both back and then relax. And then again. Again, the water is hitting in this area. Good. The next exercise Sarah is going to perform is where she takes her hands and intertwines them in back of her. And what she's going to actually do is stretch on her toes and actually reach up towards the ceiling and then relax back down. And she's going to do this about 3 to 5 times. Again, the water should be hitting and penetrating in the back of the neck and upper back. And relax. These are the best exercises to do in a shower and still be able to get some rehabilitative treatment into the neck and upper back area to relax this area, especially when pain is reduced.